Coming up next is mandated health care coverage for workers holding companies back.
I couldn't afford a health insurance plan when it comes down to it. It would probably put me out of business.
Just ahead, how one Valley company says it can help employers provide mandated coverage, save money, and keep employees healthier. Exploring new models in healthcare. Next. And welcome back to Politics Unplugged. And tonight, a segment taking a closer look at mandated health care coverage. Many employers say that it has added a burden that they just cannot afford. Figures from the Kaiser Institute show that Arizona employers pay an average of $355 per employee every month for mandated coverage. Employees contribute about $91. And of course, if employers do not offer that coverage, they are subject to big fines. And joining us now is former Phoenix Mayor Paul Johnson, who now works with a Valley company called Redirect Health, which offers employers a different way to provide coverage. Now, I want to thank you very much for joining us. And first of all, like, one of the big issues out there right now is this idea of the cutoff line being 50 employees. And explain a little bit about that, and then explain how that's affecting companies and their growth.
Sure. So what's happening with companies today is that if they're over 50, they have to go through a reporting process. In fact, all companies will have to report all of their employees and whether or not they provide health care. But if you're over 50, you end up having a $2,000 penalty that applies to your company if you don't provide what's called minimal essential care or coverage, and a $3,000 penalty if you don't give them what's called minimum value. Many employers are seeing that, and their way of trying to react to it is doing lots of things that they shouldn't be doing. One of them is not allowing their company to grow by holding it at 49 people. Another thing some of them are doing is thinking that they just won't file the 1094 and 1095 form, which is really problematic because that can cost you in the millions of dollars in fines. What they're being told by insurance companies, however, or insurance companies' representatives, is misleading. They're being told that they have to have insurance, and that's just simply not what the ACA says. The ACA, again, says that you have to provide minimal essential care to get out of the $2,000 penalty. There's 71 items in that. Those 71 items are mostly preventative items, and if you cover that, which can cost easily less than $100 per member per month, you're out of that first fine. The second fine only comes about if your employee goes to the exchange and they receive a subsidy.
Now, you guys are offering a fix. Now, explain really essentially in layman's terms what kind of fix you guys are proposing.
Well, start with the problem. What the problem really is that the existing healthcare system, you have doctors' offices that are buying up, or excuse me, hospitals that are buying up doctors' offices en masse. And they're doing that while they lose about $150,000 to $300,000 per doctor. The reason they're doing it is to make certain that they get referrals into the hospital. Anything done outside a hospital is dramatically cheaper than anything done inside the hospital. Literally, an MRI done inside a hospital can cost $2,000 or $3,000. Outside can cost $400. Well, you have to interject in that pain point to be able to break apart the big cost in healthcare. You've got to be able to get information to consumers. We believe that the biggest problem is the free market system's not working. You're not getting people information. You're not being transparent about those costs. So the first thing that we do is we create a protective layer around the employees and around the employer that help make certain that they can get information. We cover the MEC items, which means we cover those 71 items. We give them unlimited primary care, unlimited physical therapy. We have a care logistics system, which is basically a dock in your pocket, and we help them navigate the system. All of that is provided for under $100 per member per month. And then what we do is we try to encourage them to get what's called stop-loss insurance to help with the bigger claims.
Yeah, so what is exactly, explain a little bit, what is Redirect Health and how does this help people meet those requirements?
I would tell you that Redirect is a disruptor to the healthcare industry. We're disrupting the typical model of health insurance. Our goal, our moonshot, it really revolves around the idea that we have 17% of our GDP today is being spent in healthcare. It's on the way to 23%, and that's not sustainable by any number. Our goal is to help employers lower those costs so that they can provide as close to free as possible health insurance to their employees.
Have you guys done any kind of research to show, like, about how many jobs, at least here in Arizona, this cap, with decisions by employers to stop it growing at 50, how many jobs that has cost the state?
There are studies, both national and some that are done local. I can tell you on a national level, it's when you make companies uncompetitive or non-competitive on healthcare, foreign companies end up picking up the work. So getting costs lower, I think, is a national objective. On a statewide basis, We lose jobs for two reasons. One, because other states can be more competitive if they're able to find ways to create more competitive health care from employers. But also you end up, just as you said, a number of those employers stopping at 49, which means they're spending money on health care and not on expanding, not on capital improvements, not on moving into other markets.
Now, as mentioned earlier, providing coverage can be expensive in Arizona. The average employer kicks in about $4,200 a year per employee to provide coverage. What does someone using Redirect Health generally pay?
So in general, the everyday care, which is again the protective layer around the consumer and the employer, they pay about $86 per member per month. Because you're allowed to charge up to 9.5% to the employee, all of that can be charged to the employee themselves. Then they will provide a bronze plan for them, which allows them to have hospitalization on the backside. Those plans are generally running about $200. So we're running anywhere between 30 and 50% lower traditional insurance through self-administered plans.
Yes. Now, you just described yourself as a disruptive force here in the healthcare industry. I can't imagine the reaction to this has been all positive. Tell us a little bit about the political fallout from for a company doing this kind of work.
Well, we're definitely, there are lots of challenges to growing a disruptive company. One of the challenges, our incumbents don't go away easily. Which is part of the fun in it. Today, insurance companies, the ACA basically says that they have to have 85% of their revenue in costs. That means they're not really incentivized to cut. So trying to find a model which gives the employer an incentivized to cut is helpful, but that doesn't always make the traditional insurance carrier happy. And on hospitalization and specialists, our goal is to make certain that we get consumers the information so they can compare. We don't tell them which one to pick, but we give them a real comparison so they understand what the costs are. Some hospitals have been very helpful in that. A number of them do not want any transparency in pricing. But again, the only real solution to cutting costs, in my opinion, is a free market. It's getting information to people, being transparent, and letting consumers have choices.
So I take it you're not a big supporter of the Affordable Care Act?
I did not support the Affordable Care Act when it passed. I thought that there were big problems with it. You were adding on more regulations. I would tell you, I think it's already here. What we ought to try to do now is to modify it and to come up with something that's better. I'd like to see the opposition to it look to try to find ways to insert more free market options into it.
All right. Thanks a lot for joining us this week on this segment here.